Welcome back. Well, the demand for coronavirus testing in Texas remained near a record high Tuesday. There were more than 181,000 tests reported. The percentage of positive tests remained high at more than 33%, but is lower than last week. So as the U.S. begins offering 1 billion free COVID tests, we get some advice this morning on which test to use and when, as the Omicron surge continues here in North Texas. And we say good morning again to Dr. Joseph Chang, Chief Medical Officer at Parkland Health. Good morning.
Hey, how are y'all today?
Pretty good. First of all, we want to talk about these tests. They're expected to arrive 7 to 12 days after you order them. And that's kind of after Omicron is expected to peak in a lot of parts of the country. What about here?
Yeah, I mean, that's kind of an issue, right? Yeah, we're expecting our peak here in about 10 to 14 days. Hopefully before, obviously for our hospitals, the sooner the better. So hopefully those tests can be FedEx a little faster than that.
That would be nice. And of course, even with 1 billion tests being mailed out, certainly more are going to be needed. We want to kind of give our viewers some advice this morning on which kind of COVID test a person would need to take. For instance, if they have COVID symptoms, versus a test that they would take if they're afraid that they've been exposed to someone, say at a school, but they don't have symptoms?
Yeah, I think that's a really good question, and the interesting thing, of course, is these billion tests or whatever that can be requested and being sent out. Those are called antigen tests, right? Those are really fast, but they really only work when you have symptoms. If you don't have symptoms, those tests are basically like a coin flip. So I would definitely not suggest using those rapid antigen tests if you're just wondering if you have been exposed to COVID. However, if you do have symptoms, those tests are about 85% accurate. Now, that said, the PCR tests are always better, okay? Now, those are not ones that you can do yourself at home. You're gonna have to go somewhere and get those. But the PCR test is always going to be better.
All right, so which test do you take if you've tested positive and you want to make sure that you're no longer contagious?
Well, again, the PCR is always going to be better, okay? But if you do want to use those rapid tests, my advice would be to do 2 of them on successive days. All right, so maybe you're feeling better on a Thursday. I would go ahead and take it on a Thursday and then take it again on a Friday. If they're both negative, then you can feel pretty good about it.
All right, so I've heard this discussion pop up a couple of times here and there. Is it possible to over-test?
Well, over-testing is probably only bad for your psyche, right? I mean, because these tests aren't 100%. Certainly these rapid ones, so you can get a positive one day, and that could be a false positive. You get a negative the next day, and that could be a false negative. So from a psychological standpoint, I would tell people, only test when you need to. Number one, it's just going to freak you out, right? Either that or give you a false sense of security. And number two, really, again, I told you, they're not very accurate if you don't have symptoms. So taking them all the time, it really just going to freak you out. So I would advise people not to do that.
And when you say symptoms, or they're better if you have symptoms, or more accurate,
right? You're
talking about maybe multiple symptoms, or even just, let's say I've got a headache, and do I take one if I have a headache?
Yeah, I wouldn't do that, right? I mean, people get headaches all the time. Heck, I get headaches almost every day here at Parkland Health because of all the stuff I do. So I would say no. If you feel sick, right? I mean, use your best judgment, right? You got runny nose, you got a cough, you're coughing up stuff, you got a fever. Yeah, those are reasons to take a test. But you just got a headache, take a couple Motrin and see if it gets better.
Yeah, I'm with you. We get up pretty early in the morning. We get a lot of headaches around here, too.
That's right.
Sometimes coffee helps, but you never know. All right.
All the time. All the time.
Dr. Joseph Chang, we appreciate your time this morning. Thanks.
Absolutely. Have a great day.